Hi, my name is Ken Cutbush. I'm a shoulder surgeon working in Brisbane. I'd like to talk to you about arthritic AC joints. Arthritic AC joints are very common. In fact, once we're over 30, most of us have a worn out AC joint, but only some of us are actually symptomatic. And it's only if we're symptomatic you need to worry about it. A lot of people get sore AC joints working out in the gym, particularly if they're doing overhead shoulder press, incline bench press. There's the overhead exercise in the gym that will do it. I've done it to myself doing a lot of boxing training, and you can get it from a lot of things. It's once you're up with your arms up here doing some sort of repetitive activity or straining. When your shoulder becomes arthritic, it starts to look like this. It's this AC joint that we're looking at here. It's the connection between the collarbone and the scapular spine, or the acromion. So it's the acromioclavicular joint. It's an important connection. It's actually the only connection between our hand and the rest of the skeleton, because the scapula itself is floating in muscle. It's the one connection between the hand and the rest of the skeleton. All the force goes through this AC joint complex here. It has a complex interaction. There are two little ligaments here, the coracoacromial ligaments, because they go between the coracoid process and the clavicle. And then you've got the AC joint capsule itself. When it becomes arthritic, you can see the joint space narrows because the cartilage wears out, so the two bone ends start to approach each other, and you start to get these cystic changes. You get some sclerosis, you can get some spurs around it as well, and the joint capsule can start to swell. And it looks like this on an MRI scan. So this patient here has an arthritic AC joint. You can see there's joint space narrowing. The joint space is irregular. They're starting to wear out. We've got fluid. On this scan, white is fluid, so we've got fluid in the joint here. You can't see any cartilage. The cartilage is completely worn out. And remember, the AC joint has a unique arrangement in that it's got cartilage on either end of the bone, plus a disc of cartilage between the two bone ends. In this scan, you can see there's brightness in the end of the collarbone here, the clavicle, and that indicates to me that this is an active arthrosis picture. It's not just the normal worn out AC joint that most of us have. This patient has a sore AC joint. There's inflammation. That inflammation's in the bone, and you can see that because there's fluid content or fluid in the bone itself, which we see as brightness on the MRI scan. This is the AC joint here on the CT scan. We can spin this around and you can see there's narrowing of the joint space, and the end of the bone is quite irregular and quite worn out. Treatment. The cornerstone of treatment is activity modification. Initially, you stop doing how you've been doing to get the shoulder so sore, and then once it feels better, start back, but never get back to the same level of load that you've given it before. So you always keep it below where you are in terms of aggravating and making it really sore and really painful. That's the most important thing when you talk about treatment. Cortisone injections can be helpful. You can get a cortisone injection into the AC joint itself. Often that's done under ultrasound guidance with the radiologist, and that can be very helpful in settling down the inflammation. It won't give you back your cartilage though. Once we've exhausted all the non-operative management techniques, and physiotherapy comes in there as well, we start to think about surgery. And what we can do with surgery is excise the AC joint. Obviously what we'd like is a little joint replacement you could put in there and replace that arthritic joint. We don't have that. That doesn't exist. So the best we can do surgically is right now you've got bone rubbing into bone. What we do is trim a little bit of bone off each side of the bone and give you a gap there, so you no longer have bone rubbing into bone, and you've got a gap there. That gap can then fill in with fibrous tissue. Now that fibrous tissue is not as good as the cartilage you had when you were 20, but it's better than bone rubbing into bone. And usually that's a very effective way of dealing with the pain that you're getting from the AC joint. What that looks like in terms of surgery is you come in on the day fasted, you'll have a general anesthetic with the anaesthetist, you'll be out to it. It's keyhole surgery. Most of us do that as keyhole surgery now. The advantage of keyhole surgery being is that we can maintain that superior capsule of the AC joint intact, and that's important for stability of the AC joint. If you get an unstable AC joint, and you can get that from excising the AC joint, it really does trouble people a lot. So we like to do it as keyhole surgery, just trim a little bit of bone off the clavicle side, the collarbone side, a little bit of bone off the acromial side, which is part of the scapula, giving you that gap. We want to get at least 5 millimeters of clearance between the two bone ends, but we don't want to take off so much bone that we detach the capsule at the top of the clavicle or at the top of the acromion. Post-op, you'll be in recovery for maybe an hour, and then on the ward, typically for one night after the operation. The next morning, you'll see the physio, you'll see me, pharmacy comes up with your meds, the nurses will change your dressings, and for me, you'll typically get out of hospital around about 10 a.m. You won't need a sling. You'll be able to get going with the physiotherapist as soon as you can. It probably is a day or two before you're happy to drive. And overall, it will take about 4 months to get over the operation. It does take a while to fully recover and go through the rehab for the operation. It will ache, it will bother you, it will trouble you a little bit until you get to that point. Typically, I'll see you back at 6 weeks post-op with one of the physiotherapists to check how everything is, and we'll both write to your physio so that everyone stays on the same page and knows what to do. So that's AC joint arthritis in a little overview. I hope that helps your understanding of it.